Hello, and welcome back to Ask Your Pain Doc. In this channel, we talk about traditional and alternative treatment for pain. Today, we're going to talk about something very common and a very exciting topic. We're going to talk about fibromyalgia or diffuse body pain. If you like my channel, make sure you click on subscribe button and turn on notification. Let's do it. Fibromyalgia is characterized by diffuse pain and tenderness. The pain and tenderness tends to come and go and move around the body. Other symptoms including fatigue, tiredness, memory loss, and sometimes mood issues like depression. Fibromyalgia is common in women, although it can happen in men, and it usually starts in middle adulthood, but it can happen in early ages or in old age. If you have any other type of systemic disease like osteoarthritis, lupus, you have a higher risk of developing fibromyalgia. Fibromyalgia does not damage any joint or any type of muscle. Fibromyalgia can happen with other conditions including depression or anxiety, migraine or tension headache, digestive problem including irritable bowel syndrome or IBS, or gastroesophageal reflux, overactive bladder, pelvic pain, and also TMJ or temporomandibular joint pain. Prevalence of fibromyalgia in the United States is 6.4%, very high. First description of the disease was provided by Guillaume de Belleau in 1642, who used the term muscular rheumatism. In 1976, P.K. Hengst coined the term fibromyalgia from the Latin word fibro, which means fibrous tissue, and Greek words myo, which is muscle, and algia, which is pain, as a form of non-articular rheumatism. It was not until 1981 that the medical community started accepting the disease under the term fibrositis or fibromyalgia. Frida Kahlo, as you know, one of the famous Mexican painters known to suffer from fibromyalgia. She is best known for her uncompromising and brilliantly colored self-portrait. She had a terrible car accident and developed severe chronic pain and fibromyalgia. Frida Kahlo's art depicts a woman bound and pierced in locations that can be strongly affected by fibromyalgia pain. There are many celebrities who have spoken out about their fibromyalgia. One of the very wonderful artists that suffers from fibromyalgia is Lady Gaga. She was originally diagnosed with fibromyalgia several years ago. She blames her illness on physical and mental components, post-traumatic stress disorder, and breaking her hip in 2013, 10 months into the Born This Way world tour. There is a documentary about her severe body pain. She described her pain as full body spasm. She is often covered with ice pack after her concerts, trying to relieve some of her pain. Other famous people are including Morgan Freeman, Kyle Richards, Mary McDonnell, and Sinead O'Connor. The causes of fibromyalgia are unclear. Current research suggests involvement of nervous system. Fibromyalgia is not from an autoimmune disease, inflammatory joints, or from osteoarthritis. Fibromyalgia may also run in families. There likely are certain genes that can cause people more prone to get fibromyalgia and other health problems that can occur with it. There is more often some triggering factors that can set off fibromyalgia. It may be spine problem like arthritis, injuries, trauma, or other types of physical stress. Emotional stress, anxiety, and depression can also trigger this illness. The result is a change in the way that body talks with the spinal cord and brain. Levels of certain brain chemicals and protein may change. More recently, fibromyalgia has described as a central pain amplification disorder. What does it mean? It means that basically your brain is more sensitive and amplify all this pain, and that can cause that severe body pain. Although fibromyalgia can affect quality of life, it is still considered medically benign condition. It does not cause any type of heart attack, stroke, cancer, physical deformity, or loss of life. A physical examination can be helpful to detect tenderness, to exclude other causes of muscle pain. There are no really diagnostic tests for this problem, yet your doctor need to do some tests to rule out if there is any other condition or problem that can be confused with fibromyalgia. Two very common conditions that can be confused with fibromyalgia are including hypothyroidism, or the underactivity of thyroid glands, and also polymyalgia rheumatica, or diffuse inflammation of the muscles and joints. The presence of pain in 6 or more body sites from a total 9 possible area. That also should be including fatigue, waking up tired. Some people also feel they have cognitive, that means memory or thought problem. Symptoms should last more than 3 months. There should be no other health problem that could explain these diffuse pains and your other symptoms. Unfortunately, there is no cure for fibromyalgia. However, symptoms can be treated with both non-medication and medication-based treatments. Many times the best outcomes are achieved by using multiple type of treatments. That means that you mix multiple type of treatments, including medication and non-medication treatments. Research suggested that most effective treatments for fibromyalgia is physical exercise. Physical exercise should be used in addition to any type of drug treatments. Patients benefit from regular aerobic exercise, other body-based therapies including Tai Chi, yoga can also help with fibromyalgia symptoms. Cognitive behavior therapy, or CBT, is a type of therapy that focuses on understanding how thoughts and behavior affects pain and other symptoms. CBT and related treatments such as mindfulness and neurographic art can help patients learn symptoms reduction skills that can reduce your pain. Mindfulness is a non-spiritual meditation practice that cultivates present moment awareness. Mindfulness-based stress reduction has been shown to significantly improve symptoms of fibromyalgia. There are lots of other complementary and alternative therapies including acupuncture, chiropractic treatment, massage therapy that can be used to manage fibromyalgia symptoms. It's very important to address risk factors and triggers for fibromyalgia, including sleep disorder such as sleep apnea and mood issues like anxiety, depression, panic disorders, and panic attacks. This may require involvement and consultation with other specialists like sleep medicine doctor, psychiatrist, and therapist. The U.S. Food and Drug Administration has approved 3 drugs for treatment of fibromyalgia. They include 2 drugs that change some of the brain chemicals, including serotonin and norepinephrine, that can help control the pain level. The one that you know, Cymbalta or duloxetine, and also milnacipran or Savella. The other drug that approved for fibromyalgia is pregabalin or Lyrica. You gotta watch our video about Lyrica. Lyrica and other drugs like gabapentin or Neurontin work by blocking the other activity of nerve cell involving in pain transmission. These medications may cause dizziness, sleepiness, swelling, and weight gain. It is strongly recommended to avoid any type of opioid or narcotic medication for treatments of fibromyalgia. The reason for this is that research evidence showed that there is no benefit of using opioids or narcotics in treating fibromyalgia. However, Tramadol or Ultram may be used to treat fibromyalgia pain for a short period of time. Other over-the-counter medication including Tylenol or non-steroidal anti-inflammatory medications including ibuprofen or Advil, naproxen or Aleve may also be effective for fibromyalgia pain. Make time to relax each day. Deep breathing exercise and meditation will help reduce the stress that can bring on the symptoms. Set a regular sleep pattern. Go to bed on time and wake up at the same time each day. Getting enough sleep lets your body repair itself, physically and mentally. Also avoid daytime napping and limit caffeine intake, which can disrupt sleep. Smoking is bad because nicotine is a stimulant, so those fibromyalgia patients with sleep problems should stop smoking. Exercise often. This is a very important part of fibromyalgia treatment and rehabilitation. While difficult at first, regular exercise often reduces pain symptoms and fatigue. Patients should follow the saying, start low and go slow. Slow add daily fitness into your routine. For instance, take the stairs instead of the elevator or park further away from the store. As your symptoms decrease with drug treatment, start increasing your activity. Add in some walking, swimming, water aerobic, and or stretching exercise and begin to do things that you stopped doing because of your pain and other symptoms. It takes time to create a comfortable routine. Just get moving, stay active, and don't give up. Educate yourself. Nationally recognized organizations like Arthritis Foundation and the National Fibromyalgia Associations are great resource for information. Share this information with your family, friends, and coworkers. Well, I hope you have learned something today. I hope this video helped with some of fibromyalgia patients to do more exercise, do more meditations, and hopefully they feel better. If you like my channel and want to support me, make sure you subscribe to my channel and also send my video to your other friends. Have a wonderful time and stay tuned for more videos from Ask Your Pain Doc.